Assalamu alaikum. And today our topic is cardiovascular shock, in which we will discuss about all the factors that causes shock from the cardio pathology or from the vascular pathology. What is shock? Cardiovascular shock is the collapse of the cardiovascular system and widespread of hypoxia to the body tissue. It has a high mortality rate. Basically, cardiovascular shock are four types. We'll discuss each in detail later on, but first we'll discuss briefly introduction about each cardiovascular shock. So first is volume failure. If a person volume decrease to 3 liter, now circulatory system is underfilled. Blood will not return to heart easily. Venous return decrease led to cardiac output decrease, which also led to cardiovascular system collapse. This is called hypovolemic shock. In this shock, for example, our normal cardiovascular system volume, blood volume is 5 liter. On average, it's 5 liter. So if the volume of the blood decreased from 5 to 3 liters, so there is not enough blood for the vessels for the heart to pump it to all the body parts. So this led to the cardiac shock due to volume failure, which is also called hypovolemic shock. We know that cardiac output in 1 minute is 5 liter, volume of blood is 5 liter, and the capacity of cardiac system is 5 liter. So more than 5 liter and less than 5 liter will be some pathological signs for the cardiovascular system, which causes cardiovascular shock. So second is pump failure. Pump failure means heart failure. Volume and capacity normal, but the myocardial infarction occur. For example, there is something damage occur to the heart muscles, so which led to the failure of the heart, and heart cannot pump all the blood through all the vessels or all the body, so which led to the cardiogenic shock. Third type is distributive shock. Distributive shock, for example, the normal volume is 5 liter and capacity should be 5 liter for the body to accommodate this volume. So if the capacity of the blood will increase from 5 liter to 8 liter, for example, more capacity and less volume, so this will lead to the distributive shock. For example, filling pressure not maintained and venous return not maintained, blood vessels dilate, led to anaphylactic shock. So for example, in penicillin hypersensitivity, IgE antibodies and mast cells are well concentrated in all over the body, but especially around the blood vessels, mucosal lining, and under the skins. So in hypersensitivity shock that when our body make antibodies IgE, our inflammatory process start, and some vasodilator products will release, and blood move toward that hypersensitivity reaction. This led to the anaphylactic shock. IgE antibody stimulate the mast cell. Mast cell increase the production of histamine. Histamine led to dilation of the blood vessels abnormally distributed. So this causes distributive shock. Distributive shock are of further three types. One is septic shock, neurogenic shock, and the anaphylactic shock. Anaphylactic shock, we study this and that there is hypersensitivity reaction and causes dilation of blood vessels, and blood vessel dilate, there is capacity increase for the volume. And second, there is a septic shock. Septic shock, there is septicemia. In bacteria and blood. Bacteria high concentration blood release endotoxin products. Our immune system react with these and they release cytokines and various other factors cause the dilation of the blood vessels, which causes increase volume capacity of the vessels. So third is the neurogenic shock. Neurogenic shock in the sympathetic nervous system fail to work. For example, if the sympathetic nervous system cannot work, all the blood vessels dilate and the total capacity of your heart will increase. That causes distributive shock. Fourth is the lumen failure. What is lumen failure? Lumen failure, for example, when the heart pump is normal, volume is normal, capacity is normal, but the lumen, for example, lumen is the inside diameter of the vessels. So inside area of the vessels, how much the diameter? If the diameter will decrease, blood cannot move from the blood vessels to small arteries, veins, and the venous return will also decrease. So this is the lumen failure, which is also called obstructive shock. So these are the four main basic types in with the hypovolemic shock, cardiogenic shock, distributive shock, and the obstructive shocks. These are four main types of cardiovascular shock. Now we will discuss each in detail. First is hypovolemic shock. Hypovolemic shock, the causes. First cause is there is a bleeding. First, hemorrhage. If there is a bleeding and volume of the blood will lose, that causes hemorrhage shock. And second, there is a second external factors, hemorrhage like trauma, GIT bleeding. These other factors cause a decrease in volume of the blood. Third, there is a loss of plasma. Remain cells too much concentrated and hematocrit increase. Second, there is an external factor and internal factors. Internal factors like ectopic bleeding, rupture of ectopic pregnancy, hemothorax, hemoperitoneum, and the aortic aneurysm. And for then the burns. In burns, tissues severe endothelial gap, lot of the plasma ooze out of the from volume system. For the in the exfoliative dermatitis, in which the lot of plasma leaks out into which skin, central nervous system defined in the volume. Loss of fluid, electrolytes. Loss of fluid for the external and internal factors will be the fluid will loss. Severe diarrhea plus vomiting, which also can decrease in the volume of the blood. Polyuria, increased urine, so volume of the blood will lose. Without replaced. For example, if someone is have polyuria disease during diabetes and he's not taking blood in the same amount that is passing through the urine, so which causes the hypovolemic shock. Severe or excessive sweating led to the dehydration. Internal ascites, bound GIT obstruction. Acute pancreatitis led to inflammation spread. Inflammation spread, swelling area and trap a lot of fluid and formation of the pseudocyst. And so the pseudocyst also containing fluid that led to the hypolemic shock. Second type, second type is cardiogenic shock. In cardiogenic shock, heart is unable to produce cardio output. So the causes are the arrhythmias. We know what is arrhythmia. Arrhythmia is abnormal. For example, our heart beat in a normal rhythm. First atria contract, then ventricle contract. Atria contract and they drain blood into the ventricles. And when ventricle contract, at the same time, left ventricle drain blood, push the blood, pump the blood into the aorta and its branches. And when the right ventricle pumps, push the blood into the pulmonary trunk, pulmonary veins. So this is the normal rhythm of the heart. So what is arrhythmia? Arrhythmia, there is any obstruction or any changes in the normal rhythm of the heart is arrhythmia. This occurs due to the heart electrical activity abnormalities. For example, heart suddenly contract more rapidly or suddenly contract very less contraction, or maybe suddenly heart may be abnormal rhythm. For example, first atria contract, at the same time maybe ventricle contract. So this is all the abnormal rhythms. So first we'll discover tachycardia and bradycardia. If the heart is contraction increases, that is tachycardia. If heart contraction is slow, that is bradycardia. Tachycardia due to ventricular fibrillation that lead to the increased electrical activity of the heart. When the electrical activity of the heart is increasing, its cardio output decrease due to decreased systolic volume. And this is how that when we increase the systolic volume, for example, normally systolic volume of the heart is 70 ml. So if we increase the electrical activity of the heart, for example, first heart is beating at 72 rate per minute. Now the heart is beating at 100 rate and 100 beat per minute. So electrical activity of the heart is increases, beats increases, but the systolic volume will decrease because systolic heart will when contract rapidly, it will take very less time for diastolic to fill the ventricles. So when it will very less time for the filling of the heart. So systolic volume will be decreased. So when the systolic volume will decrease, then led to the cardio output also decrease. Slight tachycardia, increased cardio. For example, if the heart is in the beginning suddenly, for example, in the beginning slightly heartbeat increase, tachycardia, that causes increased cardio. What if the heart is tachycardia is for a long time, for a very long time, that led to the cardiogenic shock because with the long time increase in cardiac activity, increase in cardiac contractility, which led to the decrease in cardiac output because when the heart contracts very rapidly, they will take very less time to fill the ventricles and very less time to stroke volume. So in bradyarrhythmias, in brady heart will contract very slowly, so the heart rate will be decreased. So when the heart rate will decrease, so we know that cardio output is equal to heart rate to systolic volume. So cardio, which is cardio proportion to heart rate. If heart rate decrease, then obviously cardiac output will also decrease. This is how that, for example, normally is 1500 ml is equal to 10 into 10. So if the heart rate is increased, cardiac output will also decrease. When the heart rate is increased, that to cardiac output decrease because both are directly proportional to each other. Cardiac output is heart rate into stroke volume. But after a certain line with further increase in heart rate led to decrease the cardiac output because with increase the cardiac output because with the decrease in cardiac output because with the increase in heart rate there is a decrease in stroke volume. Same I explained you earlier. So decrease in further when there is decrease bradycardia, for example, there is increase in heart rate, contract very rapidly, their stroke volume decrease. Stroke volume decrease led to decrease in cardiac output. And simply you understand the same this formula. Cardiac output is equal to heart rate into stroke volume. If the stroke volume, one of them will decrease, led to the cardiac output decrease. In the bradycardia, this heart rate decrease. In the tachycardia, this stroke volume will decrease. So which led to decrease in cardiac output and led to the cardiogenic shock. Heart rate is normally 72 beats per minute. Cardiac cycle is 0.8 second. So 0.3 second is for systolic and 0.5 second is for diastolic. So when the heart rate is increased 3 times 216, so its time to filling diastolic will decrease by 3 times 0.26 seconds. So 0.26 second per cycle. So 0.2 second for systolic and 0.05 second for diastolic. So we can compare this that diastolic time from 0.5 second to 0.06 second. So you can imagine that how much time decreases for the ventricles to fill. So where less ventricle filling decrease to decrease systolic volume, decrease cardiac output. From this you will understand this in detail. Massive myocardial infarction led to the heart pump failure. Massive myocardial infarction led to the pump failure. Okay. So we know that cardiogenic choke is also pump failure. So we discuss in detail the massive myocardial infarction led to the pump failure. Myocardial infarction is the damage to heart wall, heart muscles. So if the heart muscles will damaged, then heart cannot pump will contract with powerfully. So it will lead to myocardial infarction to pump failure. Pump failure, severe valvular regurgitation. Pump failure, massive myocardial infarction. Pump failure due to massive myocardial infarction, cardiomyopathy, which is dilating cardiomyopathy, in which the left ventricle is too much dilate that cannot meet cardiac output. For example, in cardiac cardiomyopathy, dilating cardiomyopathy, the left ventricle is dilate too much. It accumulates more and more blood. So there is a formula that pressure is equal to tension over radius. So if the radius of the ventricle will increase, we know the pressure is inversely proportional to radius. So when the radius increase, its pressure will decrease. So there is less pressure for the left ventricle to push blood in the aorta. So there is less pressure. So there is systolic volume decrease. It means there is a cardiac output will also decrease. So cardiomyopathy, which is dilating cardiomyopathy, and cardiomyopathy three types: restrictive, constrictive, and the dilating. So dilating cardiomyopathy is one of the cause of the decreased systolic volume and led to the decreased cardiac output. So severe valvular regurgitation. For example, what is valvular regurgitation? We know that there is a mitral and tricuspid wall in the our heart between the atrium and ventricles. For example, if the mitral regurgitation means that, for example, during our systolic, our ventricle systole, the mitral valve should close, so blood cannot regurgitate. Regurgitate means pull back from the ventricle to again to back to the atrium. So if there is mitral valve regurgitation, for example, mitral valve cannot close properly, blood will regurgitate from the ventricle back to the atrium. So this will also decrease the total systolic volume or systolic volume. So when there is a decrease systolic volume, led to the decrease in cardiac output. Similar. And the next type, our third type, is distributive shock. We know distributive shock is problem in the vessels during dilation or constrictions. So pathology of dilation of the vascular system in body is normal 5 liter, and capacity increases. For example, normal volume remains same, but the capacity of the holding the blood of our blood vessel will increase. So blood cannot properly return to heart, and this which led to massive dilatation of blood vessels is distributive. First, their cause is neurogenic shock. We know that our blood vessel system also controlled by sympathetic nervous system, where the vasomotor center present in the medulla oblongata, which have give 5 points to transmit the nerve impulse to the blood vessels. One is vasomotor center, sympathetic nervous system, preganglion, postsympathetic ganglion, and the attached at the end of the post-sympathetic ganglion and the blood vessel. Any damage to this point, any damage to one of these 5 points will lead to the loss of the sympathetic nervous system stimulation. So will lead to the dilation of blood vessels. Second cause, there is an anaphylactic shock. Anaphylactic shock, for example, during allergy, someone has some allergy from some medicines or from some foreign allergens. So when they from the foreign antibodies, foreign bodies goes into our body, our immune system make antibodies against these antigens, and during this process, Ig antibodies is released, and these Ig antibodies hold this antigen, which is the foreign, and take it to the mast cell. Mast cell will stimulate it and release histamine. When histamine releases, it causes dilation of the blood vessels and accumulate more and more fluid to this side, causes inflammatory process. So more and more fluid, dilation of blood, more and more fluid to the inflammatory side, and less fluid to the systemic circulation for the maintain the cardiac output. So this will lead to a decrease in overall volume of the body and causes anaphylactic shock. Third is septicemia. What is septicemia? Septic shock. Load of bacteria in with the toxin, endotoxin, wobblers, and the load of cytokines, leukotrienes, increased permeability of the blood vessels, and fluid ooze out from the vascular system and interstitial area and led to the shock. So in this happened that when there is a lot of bacteria, they release a lot of toxic substances, endotoxin in the circulation, and during in response, our body immune system will activate. They send WBCs. They release leukotrienes, cytokines to stimulate body system that there is some foreign antigens and release some mediators to ask for more and more blood to the same area. So more blood, more neutrophil comes. So in the same process, more and more blood will divert toward this inflammatory side, and less volume will be in circulation to maintain the cardiac output. So this led to the septic shock. And the fourth and last type is obstructive shock. In obstructive shock, first there is a cardiac tamponade. Cardiac tamponade is a situation in which when we know that our heart ventricles need some place to dilate for relaxation and for contraction. So when the heart ventricles cannot contract or relax properly, for example, some pressure outside the heart ventricles which force them to not relax. This situation is called cardiac tamponade. This may be due to the some pericardial effusion, maybe constrictive pericarditis. Any cause that causes the restriction of the cardiac for the ventricles to relax properly, led to situation cardiac tamponade. Cardiac tamponade situation is a condition where the heart is so much compressed by the pericardial effusion that its flow is obstructed due to led to the increased JVP, increased jugular venous pressure, decreased blood pressure, distant heart sound, and can hear when flow is obstructed. This is called obstructive shock. So when the heart cannot relax properly, they cannot accumulate proper blood during systolic pressure. So when there is less blood will taken into the ventricle, the back pressure increases in the pulmonary circulation. So pulmonary circulation blood pressure increase led to the back pressure to the right ventricle, right atrium, and back to the superior vena cava and led to the increased jugular venous pressure. So jugular venous pressure decrease. First side effect, jugular venous pressure increase. Second, there is also pressure on the liver and causes damage to the liver and increase portal venous circulation pressure increase. Second, our systemic circulation pressure will decrease because there is very less systemic blood goes into the aorta through all the arteries. So this causes to the obstructive shock. Second, there is the tension pneumothorax. As it progressively accumulating in lungs, air is progressively accumulating in lungs cavity. It keeps on pressure in lungs. Mediastinum displaced and major venous supply to the heart bend, decreased venous and led to the shock. For example, if there is more air into our thorax from the pleura or from the lungs, that causes the compress of the arteries around the heart or veins around the heart will lead to decreased venous return. That causes obstructive shock. Third, there is a pulmonary embolism. If big thrombus from the leg move to the head, stuck in pulmonary condition led to the pulmonary obstructive shock. In tumor arterial myxoma, if the lumen in mitral, if the tumor in the mitral valve and block its severe destructed in cardiovascular flow. So any tumor which block the blood circulation causes obstructive shock. Atrial mural thrombus formed in the left atrium block it. For any tumor or any thrombus which will block the circulation or will block the lumen of the blood vessels causes obstructive shock. What is syncope? Syncope is a transient loss of consciousness due to the generalized hypoxia to cerebral cortex. Fear, prolonged standing, micturition, severe cough. This causes severe activity of the parasympathetic nervous system when parasympathetic and vagal activity, which led to the heart relax for a few seconds and cannot maintain blood to cerebral cortex and causes loss of consciousness. These all are the types of the cardiovascular shock. Now we will discover the stages of shock. For example, during the shock, there are some three stages. In which first stage we can recover easily. Second stage which should be treated in the hospital in emergency situation. Otherwise you can die. Third stage in which all over the damage to our body will be done, and after treatment there is very less chance to be survival. So stages of shock. First stage is compensated stage and non-progressive at injury site. So during this stage, non-progressive and non-compensated. Second, there is a progressive stage of shock. Third is refractory shock or irreversible stage. Now we will discuss about the non-progressive compensated stage. In the non-progressive compensated stage, first there is a sympathetic adrenergic system activated, in which there are a body system, there is a baroreceptor in the blood vessels, and that will, when there is decreased blood pressure, this decreased blood pressure led to the activation of these baroreceptor. They will be stimulated, and they stimulated led to the decreased action potential to our brain center. So when the action potential, this is the total mechanism how this vasomotor center activated. So if there is decreased action potential, decreased suppression of the vasomotor center and led to the vasomotor center active, increased sympathetic outflow. When sympathetic outflow will increase, it led to the heart, veins, smooth muscles to contract, jugular juxtaglomerular apparatus of the kidney to from adrenal gland to aldosterone to absorb more and more water. So these are the other factors done by the sympathetic nervous system to maintain the blood circulation. These all factors led to the increase in return, increase release epinephrine, increase in stroke volume, heart rate, and cardio output. So blood pressure try to be maintained by these factors. First, there is a sympathetic adrenergic system. Second, there is a renin-angiotensin-aldosterone system. Renin-angiotensin-aldosterone system, and there is a less blood flow to the kidney. Kidney is stimulated. There is renin goes to the from the liver, convert the angiotensin to angiotensin 1. Angiotensin go to the lung capillaries, converting angiotensin 1 to angiotensin 2 by the angiotensin converting enzyme. And this led to the constriction of the blood vessels. And angiotensin 2 led to the constriction of blood vessels, activation of aldosterone to release more, to absorb more and more water, and solid retention. So in this way, they will maintain the blood pressure. Antidiuretic hormone release from posterior pituitary gland synthesized in the hypothalamus and released from stored in the posterior pituitary gland, released from the posterior pituitary gland, and causes absorption of more and more water or vasopressin. IDH of antidiuretic hormone vasopressin. Third is the reverse stress relaxation of circulatory system. When there is an increased volume, our capacity will increase. When the decreased volume, our capacity will decrease. So in this way, they constrict the blood vessel to maintain more and more constriction to maintain more venous return to the heart. Second stage, the progressive stage. Now, if the bleeding condition, there is the reduced blood supply to the tissues and reduced oxygen. From glucose, there is a formation of the pyruvic acid and led to lactic acid, and lactic acid into circulation. Lactic acid acts as a myocardial depressor and vasodilator. At this stage, vessels become resistant to vasopressor, venous return less. So less cardiac output will decrease. Further hypoxia to the tissue start, further lactic acid and further decrease in cardiac output. So with hypoxia so severe, these cells injured and release nitric oxide, which causes further vasodilation. Severe myocardial depression, vasomotor central failure, this is lactic acid and carbonic acid. These all causes further severe of the second stage, which is the progressive stage, led to failure of the circulatory system. During this process, we can treat the patient by giving fluid, by glucose. So in this stage, we can sort of save the patient, but there should be any treatment. Without treatment, patient will die. Without treatment, patient goes in the third stage, refractory or reversible, in which there is no chance of life. All body tissue committed suicide due to the hypoxia. Sodium and calcium inside the cell and potassium came out of the cell. All the action potential will disturbed. Low ATP. Acidosis situation occur in the cell due to lactic acid formation, injury to lysosome, the lysosome enzymes coming out. These hydrolysis start destroying cell structure heavily. So our immune system, our body system, which is normally working, will disturb, led to decrease ATP, ADP, AMP, adenosine, in which there is a uric acid accumulating in the body because all the metabolism will stop. No oxygen cannot go back to the cell, remain in the circulation. Now, if the patient reach to hospital all this time to stop bleeding, first of all we have to stop bleeding. The patient come to the hospital in the third stage. First of all we have to stop bleeding, then colloidal solution, then blood donor. If it is not given, then albumin or the gelatin or to maintain the osmotic pressure. So if we do autopsy, for example, and what damage is on patient going to die. So these are the situation in the third stage. But if we at the end, if patient die, we will autopsy of the patient, we will find that central nervous system cells dead, heart myocardial infective situation, prolonged ischemia, liver undergo fatty change, in kidney proximal columnar tubules are necrotic, in adrenal cortex rich cell and adrenal cortex cells rich in fat globules, they decrease because, for example, in adrenal cortex there is also a lot of corticosteroid formed due to the fat, because for using fats. So we will see in the adrenal cortex there should be fat more, but in fat used more and more to form lactic acid formation, so the decrease in fat in the adrenal cortex cells, and fat into aldosterone, corticosteroid, GIT, microinfarctive necrosis in GIT, the lungs become edematous. So these all the changes in the patient after dying. Septic shock. What is septic shock? Septic shock, number one cause of death in ICU in USA. But now we will discuss three terms: bacteremia, septicemia, and endotoxinemia. What is bacteremia? Normally in our blood, bacteria is present, but our immune system will guard them and kill them, so they will not cause any damage. Septicemia, when bacteria in our circulation they multiply too much that our immune system cannot overcome this, that is produce a situation called septicemia. For example, inactive bacteria is bacteremia in our circulation. When bacteria will divide, multiply, and release endotoxin, this is called septicemia. And endotoxinemia, when the bacteria release lot of lipopolysaccharide, there is the endotoxin molecule in the circulation. This causes endotoxinemia. This endotoxinemia is